Often.
Hello and welcome back to our CAST project and YouTube channel, Understanding the Life of Doctors. Today we have with us Dr. Pradeep. How are you, sir?
I'm fine. I'm fine. Let me just go ahead.
Yeah,
Yeah.
we'll just go ahead and starting from the beginning. What is your current profession and what is your primary role?
So I am a laparoscopic general surgeon. I'm working as a visiting consultant in multiple hospitals, and I'm a freelancer. Basically, I don't work for anyone. I'm a freelancer attached to multiple hospitals where I go and perform surgeries. Okay.
Yes, sir. So when did you decide to actually become a doctor and was there some inspiration, a person who inspired you or a situation?
Okay. So my mother was a general practitioner. She's passed away right now. So she was one of the reasons for me to really think of medical as a branch. And so basically, we are a family of doctors and engineers. So my father is an engineer, my mother is a doctor, my sister is a doctor, my brother is an engineer. So I had only the option of either medicine or surgery. So engineering. So I preferred medical over engineering. Simple.
That's great, sir. And it is popularly believed that you have to be very good at academics and studies to actually be a doctor. So was this true for you or?
So academically, see, the basic thing is the admission process is so hard. All right. So unless and the only criteria for selection is academics, right? So unless you really score there, there's no way you're going to get into it. So you can have a capitation seat which you have to pay money, or it's purely based on academics. So in academics has to be good. Yes, academics has to be good. So otherwise, you just can't get into it, right? Not in India, at least. I mean, I don't know which pro forma we are planning to follow here, but if you are looking at India, unless you are academically sound, there's no way you can get into MBBS in India.
So what are some of the academic qualifications you have obtained over the years?
No, as in related to medicine itself or related to something
Yeah,
else.
related to medicine, I think.
So
Not.
I've done my undergraduation, then I did my post graduation in general surgery. And then on the side, I learned laparoscopic. I specialized in laparoscopic surgery on the side, and that's the only thing. So nothing more, nothing other than surgery and progressing beyond my skill. That's it.
Having touched upon MBBS and qualifications, what would you say is more difficult, getting into MBS or actually studying and working on the course?
So see, it's like this, getting into MBBS is so tough. The kind of competition, and once you do get in, you see, getting into MBBS, you really need to score good marks. Getting out of MBBS is just have to pass, right? So obviously, and once you have climbed that ladder where you got into the institute, then your stress level has gone down because you just have to do the course and you'll come out of it somewhere or the other. You'll become a doctor. So the stress level goes down. So yes, I would say getting into MBBS was tougher than actually becoming an MBBS doctor. Yes.
And would you say that your expectations for the MBBS course matched your reality or was it different?
In the sense of the knowledge which we acquired, yes. So we started off with a clean slate. I had no idea what to expect from MBBS. All right. So it's not like we know what we're getting into when you take up MBBS. But having gone through the curriculum and when I became a doctor and I came out, I realized what we gain is only practical knowledge. The theoretical knowledge, what you practice and what you really carry through is totally different. It's not just the bookish knowledge, it's also how you interact with people, and a lot of things come into play which you gain with experience and not really learn it. So per se, the question of whether what I learned during MBBS helps me, obviously it does. Obviously it does. But then Sorry, sorry. Sorry, I went somewhere off. Yeah, we're on.
Yes, sir, that's no problem.
So learning from MBBS per se, obviously it is important because that is what I am practicing. But whether it taught me everything, no. Market actually taught me everything. I would say residency taught me more of how to interact with people and how to understand the pain and application of my theoretical knowledge. We learned more in residency and in private practice.
So,
So,
sir,
how
would
was
you,
your
one minute, I just have a follow-up question, sir. So, would you say you learned more application in your postgraduacy rather than your undergraduacy?
Yes, because undergraduate studies are more of theoretical, no? No, you sit and study, right? So, and the decisions which I take, I do not employ on the patients any which way because that has to go through the resident or I have to ask my boss. When I'm a resident, I'm responsible for the patients in my ward under my care. So, it obviously helps me understand what I've studied, helps me practically apply what I've studied, and also be responsible for my decision. Whereas in MBBS, I'm not really so responsible, right? I have to go, my boss is more responsible, or my registrar is more responsible than I am. Okay.
Yeah, so would you say that residency was the most challenging phase of your as a doctor, or
Challenging phase, Nityam, it's the same thing. It's a different side of the coin, right? So when I went into residency, it was something which I had not done. So, like I said, it was more. I realized what I read, how important it was in my residency because that is the time when I started to apply it. Right. So obviously yes, but and that residency is I'm doing what I want to do. Where MBBS is you're a master of, you're a bachelor of all. When I'm doing residency, I'm going to be a mastery of one thing. One thing is the thing which I like. This is surgery. So obviously it's more interesting for me. So that is where it helps. Residency helps because you're more focused in what you're doing now. And I know that that is going to be my future. I'm going to do that for the rest of my life. Right. So
are you,
residency,
yeah,
yeah. Tell me. Sorry. Go ahead.
yeah, are you happy with the progress you've made in your personal
Oh,
life
yes.
and your
Yes.
career till now?
Yes, absolutely. Absolutely. All absolutely happy with what I've taken. Yes.
And did you have time to pursue other interests along with studying and academics?
So other than academics, I was into swimming and water polo when prior to becoming joining MBBS. So that is one thing which I could never do because I just didn't have time for that. But yes, I did get into some the college magazine. I had become one of the part editors and things like that. But really, you don't get so much of time. If you're taking something like medicine, it's like a complete vocation. It takes it takes everything from. So you can't. So you could have a something like a small hobby. You could learn music, or you could do something on the side if you're so bent. I was never really bent towards it. I was more into reading. So either I was reading about medicine, I was reading about something else. But you don't really have so much time when you're doing your MBBS or residency to really catch up with something else. You could continue with a certain hobby of yours. So you could be, say, some people went hiking, some people took up singing, some people took up dancing, but it's just a hobby. You cannot say you can have a second, thing going on, which is as seriously as your medicine. No, you don't get time for that. Absolutely no time for that.
So, did you get the time after finishing your studies? So, like right now, do you get the time to follow it?
Yeah, so right now what I'm doing, Arnav, is I've got into something like running. So I've got a couple of my friends. So I try to sleep early. I do my marathon. I do marathons or at least half marathons now because I don't really have time for full marathons. So I'm doing that. I do swimming. I do swimming as and when I can. So things like that. But yes, you have to make time for yourself, and that is like any other profession. If you really feel like you want to work the full day, you can, or you feel you want to take time out for yourself, you can do that also. But yes, you do good time for yourself. Once you settle down, you realize how much you want to work. You can fix your own time limits, and according to that, you can take your time off.
So would you say that understanding the life of a doctor is important before aspiring to be one?
I would, you better know what you get into. See, it is fun when it is, you going into something unknown is always challenging and fun. But in case of a medical field, if you are really inclined to it, see, you get pretty old by the time you're out and you start practicing vis-a-vis some of your colleagues who get into, say, an IT or an engineering, right? Medical is a long drawn process. So, do you really have uh, the attitude, more than the attitude, whether you're so hell bent on being a doctor? And what you see, as or all the success stories, there are a lot of doctors who are not so successful. I'm talking about financially as well as everything. So whether you're going for the glamour, whether you really are interested in it, whether you really want to work hard, whether you really want to put in that kind of effort, when you see your friends from engineering going out for a movie, you say, "Nahi boss, I can't go anywhere." When in residency, you're not sleeping for 24 hours on the go, 48 hours on the go. Whether you really want it. So I would rather what you get into. It's not, don't have a blind leap of faith and get into it. No. Better go down, see what it entails working in a municipal hospital or any of the government hospitals. The kind of responsibility, the kind of stress. If you're up to it, there's nothing like it. So it's not like a profession. Medical is more like a vocation. So you think about whether you think of it as a vocation or as a profession. That should be easier rather than just looking at a few successful guys and thinking, okay, this is what I want: a big name, a lot of respect, a big car. No, it doesn't happen to everyone. Doesn't happen to everyone, right?
Yes, and penultimate question, what would be your advice to students who want to pursue medicine?
If you want to become a doctor, like I said, if you're looking at it as a vocation, it's a brilliant branch. It's an absolutely brilliant branch. You get everything, right? You get satisfaction, you get name, fame, money, if that's your kick. But there's also that personal satisfaction of doing something good. So that is always going to be there. But then there are a lot of sacrifices also. So if you really are willing to go through the grind, willing to accept that there will be days when you will miss your lunch, you'll miss your dinner, you'll miss your sleep, and that is okay, then it's absolutely fine. Then it's absolutely fine. It's a brilliant profession. Yes.
And ending it on a personal note, so what would you say is the highlight of a professional career so far?
The job satisfaction, with other than just the monetary aspect and everything of it, the job satisfaction is brilliant. It's a different charm when you can go and save someone's life, and it's a lot of power. It's a lot of ego satisfaction that you can do something which a lot of people are scared of. So when you, especially as a surgeon, when you're doing something which I cut open someone, and it's a brilliant equation. It gives a lot of power in your head and mind. That's nice. It's really nice.
Okay, so thank
All
you
right.
for letting us
Pleasure, pleasure,
interview.
pleasure. Yes, yes.
Thank you so much, sir.
All right.
Your insights were.
Thank you so much. All right, take care. All the best for the future.
Thank you, sir.